If you have been told that you have inflammation, the lever that you need to pull next is the visceral fat. Visceral fat is not the cause of all inflammation, but it can keep the body in an inflamed state once there. Inflammation is a presence of chronic inflammatory signals, and visceral fat is one of the things that can release these. Inflammatory signals such as TNF alpha and interleukin 6 can interfere with insulin signaling inside of the cell. Remember that insulin is a hormone and has to bind to cells to cause a cascade of signals internally to cause the cell to want to uptake glucose from the bloodstream. If there's interference in this internal signaling, insulin can bind, but the cell may not act the way that it's supposed to normally. And this can amplify the effect of insulin resistance on your inability to absorb blood glucose from the bloodstream. This can make insulin sensitivity much worse and make it easier to pick up even more visceral fat, because sugar may remain high, and if sugar remains high, insulin is going to remain high with it. Your next best step is more zone 2 cardio. And in particular, my suggestion would be the Stairmaster, because you get the effects of the zone 2 cardio, but then you also get the added effect of the muscle requirement that Stairmaster has. That additional muscle component is going to pull more blood sugar, and especially because you're using your legs, which are the biggest muscles you have. Muscles are a glucose sponge, and because it is a glucose sponge, bigger muscles will absorb more glucose. You absorb that glucose, you drop the insulin, makes your fat burning easier, reduces your visceral fat, and that will in turn lessen the effect that visceral fat has on your inflammation. But if Stairmaster is not possible, uphill walking can also be helpful. Hope this post made sense. Follow this page for more fat loss wisdom. I'll see you in the next one.